we now need to move to another very important dimension of what is going on in COVID, particularly in the UK and others, which is the children and adults mental, we call it awareness and mental health. And the word mental sometimes is still, there is a stigma already with the word mental before even we started to COVID. But I'm really delighted we have two distinguished consultants. One, we are so lucky today, one, Dr. Sara Beleil, she's a consultant on mental health, and she will deal with all these issues. And also we have another consultant, Dr. Amani, they're both available now, they will join us now. She will deal specifically with the kids. So I will bring them quickly. Thank you very much, both of you. Who want to start, Sara or Amani, as you like? You both here.
السلام عليكم. I'll probably start لأنه
خلاص تمام. Go ahead يا سارة, خلينا أعمل لك share, allowing you to share. طيب خليني بس أعمل لك allowing you to share. Sara is a senior consultant. She's a very well established consultant in mental health. She's also diaspora, she's a Sudanese, but she's also very much involved in community in addition to her work. But even in addition to her clinical work as a mental or a consultant psychiatrician, specializing on mental health and so on, but she has been working quite heavily in community, which is something also very important. And she has also been very active with the Sudanese Doctors Union in the UK and others. So she's also a campaigner, very much close to the community. She has helped involved in lots of trainings and so on within her clinical work and also within the community. So Sara, the floor is yours. Your slide is very clear, so go ahead, yes, Sara.
Thank you very much. Thank you very much, Professor Allam. My understanding is my session is in English and Arabic. So what I'll do as I go through each slide, I'll probably say a few words in English and then I'll try and translate in Arabic as well. I'm happy to be interrupted at any time with you, Allam, if you find any questions or someone needs clarification. So first of all, thank you again. Thank you very much, Professor Allam, for the invitation to participate yet again in one of your sessions. I find them really helpful, and I hope people will find this session helpful as well. It was already helpful all morning hearing the other speakers. I'm going to talk about mental health awareness. So what I'm going to do is initially, I'll speak briefly about the impact of COVID-19 on mental health generally, and then I'll focus more on mental health well-being. فأنا حريصة إنه التوك ما تكون كلام كثير مني ومن دكتور أماني اللي حتكون بعدي برضو، بقدر ما تكون إنه إجابة لأسئلة. فهو it's a question answer session. فلو عندكم أي أسئلة as I go along بس keep them ready on the chat. we'll try to respond to them as we go along. فهتكلم في الأول عن التأثير حق COVID-19 على الصحة النفسية، وبعدين هتكلم عن عموما إنه كيف نكون نحافظ على الصحة النفسية حقتنا، كيف نكون بصحة نفسية سليمة يعني في الفترة العصيبة بتاعت الجائحة دي. طيب COVID-19 يعني أنا بقى لي حاجة بديهية. Everyone knows impact on mental health of COVID-19. Worry is a big thing. Worry يعني from the start. It's been a very worrying time for most of us, for most of the population, all age groups, all countries. And it's a different type of worry. So worry about getting it. Worry once we get it. Worry about people around us and loved ones getting it as well. Worry about jobs. Worry about prospects, worry about the future. Quite a lot of worry and a lot of stress and anxiety associated with that worry. Bizarrely enough, I thought, but my children actually, of course, definitely say this all the time, the boredom. People find it really a boring time مع lockdowns. We've had our third lockdown now in the UK. فغير التوتر والقلق في ناس بيتكلموا كثير عن الزهج والملل. طبعا الناس كمان احنا عندنا في انجلترا محبوسه، في العالم كله محبوسه يعني زي ما نقول بتفاوت اللوك داونز. الحاجه الميجر that people are really suffering is grief. I don't think there's anyone who has not suffered bereavement during this epidemic في الجائحة دي. It has been a most difficult time for most of us, losing family, losing friends, losing colleagues. And it's a very difficult grief because it's not a grief, an bereavement process that we are accustomed to. Usually whenever we have a bereavement, whenever we're going through a grief period, we have certain social support networks and social support functionality to the grief process itself. And unfortunately with the lockdowns, we're not able to do that. So grief is a big issue, and that is sitting with us as we go along. يعني بتكلم هنا عن الوفيات والحزن وعدم المقدرة على الناس تتواصل مع بعض. يعني احنا بنعتمد كثير جدا على الترابط والتواصل مع بعض والعزاءات، يعني مش بس في السودان لكن حتى هنا في الدياسبرا، حتى يعني في المهجر، في دول المهجر كلنا تحصل حاجه الناس كلها بتتفق مع بعض، بيكون في سوليداريتي، في مسانده لبعض، بنتقابل، بنشيل من ازر بعض. طبعا القصه دي مع الكوفيد ومع اللوك داونز كانت صعبه جدا وستيل صعبه. اكتئاب depression is a big issue as well. And following on من السيشن اللي قبل ما أنا أتكلم كان في كلام عن smoking. Substance misuse is a big complication حاصلة حاسة بتفاوت، يعني من سجاير، من مخدرات، ومن كحول. Particularly worrying is الكحول. يمكن عندنا هنا في اليو كي السوشيال aspect of drinking عموما، الناس بتمشي البب they drink socially، لكن الناس طبعا مع اللوك داون كلها قاعدة في البيوت، فالناس اللي بتشرب كحول او بتتعاطى الكحول او مخدرات ما في عندهم ليميت. فit is very difficult when people are drinking much more than they ever did before, with all the difficult complications you get with addiction type behavior. ده غير السجاير طبعا اللي هو already تعرض له زميلي في التوك اللي فاتت. The other impact has been on people who have pre-existing mental health conditions. يعني أساساً people who are struggling with depression, with anxiety disorders, with psychosis, with OCD, with different type of mental health difficulties. Going through this period has been particularly stressful for them. In many ways, access to medication, access to follow-up appointments. ده هنا في اليو كي، لكن برضو في السودان. تلقى دكتور وين؟ يعني not everyone is able to access a doctor easily, to get the medication easily. And the coping mechanisms that people have and are used to doing are very difficult to implement during periods of lockdown and social distancing. هنا عندنا في اليو كي the Office of National Statistics has surveyed populations generally, and just like I said earlier, COVID worry seems to be the main thing. Like 70% of people, this was the one done in May and June, so about 70% of the population talked about worry about the impact of COVID, but also worry about the future, about 60% of that. 60% again talking about being stressed and anxious. And the bit I talked earlier about feeling sort of bored and that was in May, and you can imagine now with the second wave where things are at. We don't have new figures as yet, but you can imagine this is way higher percentages. The impact is obviously much more difficult on people living in urban cities. It hits more with people with low income. Again, we've talked about the BAME population, diaspora, families, again, struggling with low income aspects of things, and also people with mental illness. فينا بتكلم بس عن الاحصائيات اللي هنا عندنا في انجلترا، انه يعني نسبه كبيره جدا من الناس اللي هي برضه بس بتاكد الكلام اللي قلت في الاول، اللي هو القلق والتوتر، القلق والتوتر من المرض، لكن برضه عن من المستقبل، يعني حيحصل شنو الكوفيد ده. شكله حاسه كده نحن الناس شايفه انه when is it going to end, how is this going to map out. يعني الناس عندها التزامات كثيره، وبرضه طبعا لو كما تتخيلوا يعني انه لو ساكن مثلا في حتات بعيده، مثلا في حتات فارمز، في الفيليجز، في كده، يمكن الامباكت عليهم ما بكون as bad as في السيتي. زي يكون لو في حته ضيقه، في شقه صغيره وما في اكسس لمرقه ولا دخله. طيب في حاجات certain sort of drivers that worsen mental health that have been investigated by the Health Foundation, and again, social isolation. Social isolation has been really tough on people, general public as a whole, let alone people who are struggling or suffering illnesses. It's the impact on the elderly population has been particularly difficult. They're fearful, they're worried about their vulnerability to COVID, and generally not seeing people for month after month. يعني الوحدة صعبة جدا للتحمل، يعني ده كان هنا ولا كان حتى في السودان. نحن كسودانيين عموما بنعتمد شديد جدا على الحياة الاجتماعية بتاعتنا، يعني التواصل، بنمشي نعزي، بنمشي نبارك، بنتلاقى نتونس. الناس كونها تكون مكفولة كل زول براو has been really tough. وزي ما قلت يعني مكفول مش براك، مكفول براك لو انت عيان او لو قريبك عيان او لو زول مر بظروف حقت فقدان عزيز ولا حبيب، يعني وفاة وعزاء، فالناس كلها كل زول قاعد براو. حته السوشيال ايسوليشن دي cannot be يعني ما اقدر انا يعني عايزه اكد عليها. I really cannot overemphasize how difficult it is for people to deal with social isolation. قبل كان في كلام على انه الناس بتخاف من انها تقول انه عندها كورونا من الستيغما، لكن it's not only the stigma. الناس خايف من الايسوليشن حقت العزل. That is a very big driver، لانه الناس ذاتها ما بتتكلم وتقول انه عندها كورونا، خايفه انه عندها كوفيد، انها تتخطى في عزل، تتحجر، انها تموت براءه وحيده. people are leaving it very late before they seek help, unfortunately. Another driver of worsening mental health is domestic violence. So many of you have heard already on the news, again, lots of battering children and women specifically. The number of calls to shelters and support are sort of almost 49% at last count. هنا بتكلم عن العنف المنزلي، يعني تتخيلوا برضو النزول يكون قاعد في البيت، الناس خايفة مكفولة، الناس مقلقة. حتكلم شوية عن الظروف المالية الاقتصادية، السكن، يعني في قلق كثير جدا بيكون على الأب في البيت، على الأم في البيت، على الأسرة ككل، الأطفال كلهم قاعدين مع بعض، الناس اللي كانوا برا بيمشوا الجامعة وشغالين، الناس دي كلها مكفولة مع بعض في البيت. كمان أضف إلى غير القلق لو بقى في أساساً كمان في معاه في كحول، في مشاكل تانية. يعني الحاجة الحاسة اللي وضحت إنه في عنف منزلي زايد يعني بطريقة مزعجة جداً، يعني خاصة طبعاً للفئات الضعيفة اللي هم الأطفال والنساء. jobs and finances، ودي على مختلف levels across the whole levels, jobs and finances. So jobs and finances is not only people who worried about tomorrow's meal or next month's rent. It's also people who used to be quite rich, struggling to maintain not only lifestyle, but going bankrupt, losing businesses, worrying about how are they going to pay their workers. So it's across the board, fearing prison because they can't pay the money. It's a lot of worry across the board. فهنا بتكلم عن الحاجات برضو اللي بتزيد السوء بتاع الحالة النفسية عند الناس، واللي هو القلق على الوظائف، على الشغل، على الحالة المادية. وما بس الزول اللي بيكون مثلا مقلق على انه انا حاجيب الاكل بكره من وين، ولا حادفع الايجار كيف الشهر ده. برضه زول كان عنده مثلا بنقول عنده مثلا شركه، عنده بزنس، عنده كان قروش كثيره، يعني يكون حسب مديون للاخر للبنوك، فقد الوظيفه، فقد البزنس حقته ذاتها، قلقان حيدفع للعماله حقته كيف، الناس معتمده عليه وعلى اكله وشرابه. ف a lot of worry, a lot of distress يعني based على القصه الحاله الاقتصاديه. الهاوسنج انستابيليتي اللي هي السكن، وبعدين الناس يعني فعلا الواحد حيكون مقلق. انت بتكون الزول انت ازلت مؤجر منه عايز القروش عشان هو ذاته ياكل اولاده. فالهاوسنج سيتويشن is a huge worry. key workers انا حبيت اذكرهم هنا لانه بروفيسور فريدة قبل تعرضت لانه الامباكت حق الكوفيد في المستشفيات، وافتكر بروفيسور علام انت قلت برضه حاجه عن انه how can we help. يا جماعه ما في زول من الحقل الطبي والكادر الصحي والكادر الاجتماعي يتعرض قبل كده لجائحه بالمستوى ده. قبل بروفيسور تتكلم عن المستشفيات، السيتويشن في الوودز، في ناس في شغالين في الصحه مثلا لكن ما كانوا بيتعرضوا لحاجات الاي سي يو ولا الوفيات ولا للحاجه هم هسه شايفينها. it is tough عليهم. الناس داخلين في برضو a lot of stress about انت ما حتدخلوا اي سي يو، ما حتدخلوا، ما عندي سراير، هل في اكسجين؟ نفس القصه في السودان، في ادويه ما في ادويه. يعني الكادر الصحي غير انه هو ستريس بيشوف هو الحاصل، قلق برضو على اهله في البيت، قلق على صحته لانه بيتعرض لدوز عالي جدا من الفيروس الزول في شغله. في فتره في الاولى كان ما في حتى البي بي اي، الكمامات والجوانتيات. it was very tough يعني، وكمان في السودان it was an issue as well. فالكادر الصحي والاجتماعي هنا لأن الكاريرز هنا برضو بيشتغلوا يعني at the forefront of it. again we are worried about the impact حق COVID-19 as we go along, لأنه this has taken a long time. يعني we're really worried about إنه how are they going to cope. expectation إنه الرايز للريفيرز للمنتل health is going to rise يعني significantly. بتكلم إنه هنا عن الأطباء، الممرضين، الكادر الصحي، الكادر الاجتماعي اللي هو شغال في الواجهة. هم برضو بيعانوا من غير الشغل حقهم، غير الحاجات اللي بيشوفوها، لكن برضو خايفين على نفسهم، خايفين على أولادهم. ونتوقع انه يعني مع زي ما بقولوا لما هي خلاص الجاهزات تبتدي ان شاء الله مع التطعيم وتبتدي تقل، حنشوف كثير جدا من الناس حيكونوا يحتاجوا لرعايه صحيه نفسيه. coping mechanisms، نحن كلنا يعني عاده عندنا let me start in English. We all have our ways of managing stress and how we manage difficulties and anxieties. Many of us, sometimes it's the gym, sometimes it's socializing, sometimes it's going to the cinema, different ways, meeting friends. So with COVID, we lost all our coping mechanisms, most of us have. And that is another driver of worsening of mental health. And of course, reduced access to mental health services. At the moment, many of the services are already deployed for COVID, the physical aspect of it. So mental health difficulties, it's very difficult to get to see a mental health worker, even though I will still encourage people to seek advice, to talk to your GP, to refer you to mental health services if you are struggling. هنا بتكلم على إنه الحاجات اللي نحن بنعتمد عليها عشان نقدر نتعامل مع الصعاب، مع التوتر العاديه. يعني لما نكون مقلق في الاحوال العاديه مثلا بلاقي اصحابي، ممكن الزول يمشي يتريض، ممكن الزول يمشي السينما، يعني في حاجات الاجتماعيه اللي هي بتساعدنا. ان احنا كلنا مع الكورونا فقدنا الطرق بتاعتنا اللي هي نحن نقدر تكوب مع الايشوز. برضو المشكله الثانيه اللي هي انه الناس فاقده الطريقه ان حتى تلاقي الطبيب او تلاقي الممرض عشان تلقى سبورت للمنتل هيلث ديفيكولتيز حقته، للحاجات النفسيه اللي بتتعرض لها. ما يعني أنا بسرعة كده حاولت ألخص الحاجات الحاصلة في الحالة النفسية في الصحة النفسية بكوفيد، لكن أهم حاجة أنا بفتكر حس للتوك دي أو للمستمعين يعني للأودينس إنه الحاجات هي التيبس حاجات الويل بينج، الحاجات اللي بتخلينا نقدر نكون بصحة نفسية جيدة، بنقدر نتعامل مع القلق حق الكوفيد ده، التوتر حق الكوفيد. How do we manage this? How do we navigate this period of difficulty? ففي general tips طبعا to well-being. I hope people will, again, they're quite simple, straightforward. It's important. This is a long lockdown. And the whole pandemic is taking its time. It's really not like as if people are in lockdown during a holiday and then sort of a day or two and then next day they'll go back to work. It's important to keep a day structure, a specific routine, going to bed at night, wake up in the morning, eating a balanced diet, having that day structure and routine in place, exercising regularly, limiting screen time. It's worrying to see how many people are just watching TV all the time or on their sort of social media screens all the time. Of course, it's very important to keep connected. This has been the main coping mechanism for many of us during this pandemic, but it's important also to have some time, family time, focus on other interests, make sure that you are doing the healthy routines. I'm going to speak a bit about mindfulness as a way of coping. لكن بس ارجع ثاني اتكلم بالعربي عن الحاجات اللي هي بتساعد الزول انه يعني يقدر يمر بالمرحله دي ويعديها بصحه نفسيه يعني جيده، اللي هو انه النوم ده مهم جدا. مش النوم بتاعنا اقعد اسهر الليل كله في السوشيال ميديا ولا في التلفزيون ولا كده ونوم النهار كله. لازم الزول يرجع للحياه الطبيعيه بتاعت انه انا بصحى الصباح بلبس، بيكون عندي روتين، باكل في مواعيد معينه، باكل اكل متوازن. كلنا خايفين انه بعد الجائحه دي واللوك داون الناس تطلع الوزن زايد، فالناس تكون عامله حسابها برضه، يعني ما تقوم تطلع بها مشاكل ثانيه، دايابيتس وسكري وحاجات ثانيه وامراض سمنه وكده. يكون في داي ستراكشر، لازم يكون عنده روتين واضح ليومه. مثلا لو بتتمشى، لو بتتريض، لو بتكتب، لو بتقرا، لو بتسمع مزيكا، حتطبخ مثلا حتعمل شغل البيت، لازم يكون في روتين. والروتين ده يكون حاجه يعني منظمه، وانت تقوم وتلبس تكون جاهز، مش تكون قاعد مثلا زي بيجامتك مثلا اليوم كله. لازم الرياضه. نحن مكفولين في البيوت صغيره، لازم تحاول تتمشى، تحاول تاخذ لك جريه في الحته اللي حوالينك، يعني عشان ما تكون كمان متقرب من الناس. ولازم تكون حريص جدا على انك انت ما تتفرج كثير في التلفزيون، ما تقعد كثير في السكرين. كمان لازم الحكايه تكون موزونه شويه، مع انه نحن بنقول انه طبعا كيبنج كونكت ونكون نتواصل هي مهمه جدا، يعني ان نقدر نتعامل مع الجائحه دي. مايندفولنس اللي حاتكلم عنها حاسه اللي هي واحده من الحاجات اللي بتساعد، اللي هي انك بنقول على التامل العميق او التامل العميق، او ممكن اليقظه الذهنيه. لما يكون حاسس بتوتر، بقلق، بستريس، باكتئاب، mindfulness is really helpful. من الحاجات اللي بتساعد جدا انك انت تحاول تركز انك تعيش اللحظه نفسها. يعني تعمل تمارين تنفس، انت مثلا بتاكل في حاجه تركز في الحاجه اللي بتاكلها، بتكتب في حاجه تركز فيها، لو انت مثلا يكون مثلا انك تقرا قران مثلا تركز في الحاجه اللي بتقرا فيها as well. تتدبر في المعاني الحاجه اللي بتقراها او في الكتاب. لو بتسمع مزيكا مثلا ركز في الحاجه اللي بتسمع فيها. ما تخلي الوقت كله التفكير يكون متوتر وعشوائي، يعني من توبيك لتوبيك. ادي نفسك وقت مثلا ما اكثر من 3-5 دقائق كده، قول انا حاقعد بس هركز مثلا في الزهره دي، عين لزهره، اركز في الصفق، اركز في اللون، اركز في الريحه بتاعتها. بتدي مخك ذاتك سبيس حاجه تبريك من التوتر. فالمايندفولنس دي از تكنيك بيستعملوه هنا المعالجين النفسيين، وبيستعملوا للديبريشن، للاكتئاب، للقلق، للتوتر، للستريس. فاجان يعني ممكن تشوفوه. هو الناس في فيديوز كثيره جدا في اليوتيوب عن اللي هو التامل الواعي، افتكر اسمه التامل الواعي. قبل ما اختم بس حبيت اقول حاجات بسيطه عن السوشيال ميديا. فالسوشيال ميديا طبعا is really positive in many ways. اول حاجه هي الطريقه ان احنا we've been connecting اللي حسناها على السوشيال ميديا. نتواصل مع اهلنا خاصه احنا في الدياسبرا. يعني الجميله الجاليه حقتنا هنا في لندن برضو بتعمل لنا زوم ميتينجز، فبرضو لما الناس مع بعض keeping التواصل. لكن غير كده it's a way of انك مثلا تشتغل في البروفايل حقك، ممكن الجوب اوبورتيونيتيز، فرص العمل، professional development، بتدي الواحد opportunities تشوف الناس بتعمل في شنو، تشير انت الاكسبيرينسز حقتك. يعني اهو الزلمه مره بيتعلم حاجات حتى في المطبخ حق الطبيخ مثلا من السوشيال ميديا، حاجات هوايات، حاجات حتى الاكسرسايزز. الاطفال شايفين برضه متابعينا through السوشيال ميديا. ف a lot of positives في السوشيال ميديا as a coping mechanism و as a way of being connected. لكن بس عايزه احذر من حبه حاجات about السوشيال ميديا، وحاسه ان احنا من زوم ميتنج لمايكروسوفت ميتنج لزوم ميتنج، فبيحصل الناس زوم فتيج، بيحصل الناس هيدكس، فلازم to be limiting لازم يعني يكون نحدد الوقت اللي نقعد فيه في السوشيال ميديا. It's not all the time all the day. أمانة حتتعرض أكثر لحكاية الأسرة والأطفال، لكن again أنا يعني زي ما بنقول عايزة أوصل الآباء والأمهات إن إحنا الأطفال دول ما بيعملوا الحاجة اللي بنقولها، بيعملوا الحاجة اللي بنعملها. يعني لما يشوفون إحنا قاعدين الوقت كله في تلفوناتنا في السوشيال ميديا، obviously هم يعني حيعملوا نفس الحكاية، خاصة التينيجرز. ويعني it is not right. يعني مهم برضه هم برضه يقدروا يعيشوا الحياة بتاعتهم مكفولين من المدارس في البيوت، بيشوفوا مدارس أونلاين، كمان يكون برضه في وقت يعملوا فيه حاجات ما كلها أونلاين ولا قاعدين في السكرين. يعني حاجات زي هو اللي بنعمل احنا كنا زمان، الكشتينة، الليدو، الشطرنج، الناس تقرا كتب. that is more helpful. أنا I will stop sharing يا ماني عشان أخليك أنتي to get your slides up there.
يا دكتورة سارة، قبل ما ندخل أماني خليني أسألك بس سؤالين عليك الله هنا لأنه متكرروا كثير جدا. في سؤال أنت by the way you mentioned many things and I just said in English يعني for a long time في other lots of pains. يعني حتى أقول مثلا زي الأكاديميكس، مش أنا بس التيتشر العاديين اللي بيدرسوا في السكول لبناتنا ونحن، يعني أنا بتكلم معي كل زملائي من different universities، بورنموث، ويستمنستر، إيست لندن، كلهم. It's so boring to teach these days. Even I had lots of talk about this because every student is just having the screen blind. You don't know whether he's there or she's there, and this interactivity is killer. يعني it will make your even those who are still working is very difficult. There's so many issues. Like one of the questions always been asked, and I have this from last 2 episodes. The same like the public health, the people who talk about diabetes, about nutrition and so on. We have Tawfiq many times, not here in this country, many conferences we travel. People, they say to him, you have everything you say is good. I know this is not good for me. It will add more weight, blah, 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 all this. But they say to Ihab as a specialist, and you are the specialist now, you're telling us what is good to do, but it's very difficult to do. What you have just said, yeah, Dr. Sarah, I think most of the people that are watching you, they know the importance of sleep. They know the importance of healthy diet and so on. But we had this on and on every time. People, they say, we can't do it, Alan. Every household, they are really struggling. They particularly weekends up to 2 o'clock in the morning, 3 o'clock in the morning, which is very bad, no question. No one can ask you more than you did give us the prescription. We have to follow it. You give me like my tablet. Do you have any other way? I know this is a difficult question, if I put it this way, to give a prescription of happiness. Arfu, it's a very complicated question. Can you prescribe, how can we make our life happy? We know what you said. We have to sleep early, we have to eat early. And you made a very good point, yeah, Sarah, which we all suffer from it. If we can't sleep early, our kids will not sleep early. And so on, the same diet. The diet, for example, we ask Ihab, he's a specialist in nutrition and so on. Kids are eating so much unhealthy food these days, crisp and so on, fushar and so on. يعني يا سارة, do you have from your expertise any way to say والله this is روشتة السعادة بالرغم من إننا قاعدين في إشباع بعض، الناس كلها بتتشاكل، الدومستيك فايلنس ده ذاته أسبابه إنه قاعدين في مع بعض طول اليوم، زمان الراجل بيطلع، المرأة بتطلع، بيجوا من الشغل زهجانين عندها، ده كله أصبح حاصل. عشان نحن بنحاول نكون براكتيكال، الناس بيحبوا إنه يلقوا إجابات من الناس زي كده. انت ما قصرتي، قلت عليك. يعني في طريقه تديك داون، تقول له والله يا اخي عشان تكونوا ليله تقضي يوم جميل مع بعض، شنو يعملوا اكثر من كده؟ يعني السليبنج ده كيف يقدر يناموا بدري؟ الناس بيناموا 2 صباحا. الاكل ده كله بيكعب يا ساره، فشار بتاع، اصلا مش اي محل تجيب له نعمل الاوردر ده. شوف هذا الجنهم، نحن كبار بيجي نعمل اوردر للكبس والكلام ده. الاسر كلها بتعاني يا ساره. all families, not only Sudanese, all the families. Every family is suffering from this. We have neighbors who are not Sudanese, they are indigenously white, they suffer from the same thing for the daughter. يعني عندك any way you can go deeper؟ معلش يا سارة, it's very tricky question, لكن happiness prescription, how can we make this next 3-5 months happy to some extent؟ يعني ما fighting, ما struggle. The same thing applies to the social media, Sarah. Social media is a nightmare these days. You have following it, I'm sure you know it. Not just for the Sudanese, by the way. I ask Nigerians, I ask Caribbeans, I ask Syrians, lots of diaspora in our different network, Asians, fight stuff. They're not really smooth. They're not all funny. Particularly the Sudanese one is very stressful. Some Sudanese, they said, really, if you want us to have a happy life, stop watching Facebook. معلش, long question, لكن do you have a subscription or a prescription for happiness?
I wish. I wish, Professor Alam. I wish actually. لكن here it's the small things that count. يعني هي الحاجات الصغيرة. Small things count the most. You said, يعني أنت you said it exactly. نحن we're all living an odd time. This is not the normal time. يعني دي ما الحياة الطبيعية حقتنا. وكلنا نحن we can't wait إنه الحكاية ترجع لمجرى طبيعي. لكن at this time نحن we have to live مع situation عايشين فيه ده اللي هو الكوفيد بكل restrictions اللي حصل لنا في حياتنا. The important thing is يعني الناس ما you have to challenge negativity أو challenge إنه I cannot do this. challenge الidea بتاعت إنه أنا ما حأقدر مثلا أنوم بدري وأصحى بدري. ما هي أنت لو أساسا حتسهر الليل كله الصباحية لازم أنت لو حتكون تعبان. The trick to doing this is staying as much as possible till as late as you can لما تكون ما نمت بالليل عشان تنوم زي لما من زمان نعود الطفل الصغير انك ترجع تنوم الليل وتصحى الصباح. يعني حتقوم تخليه الصباحيه تشغله بحاجات بحيث انه بالليل ينعس لكن ما تديه فرصه انه الصباحيه تنام ولا ياخذ له غمضه. يعني ف small things count a lot. A diet again about انه الناس تبقى creative. ممل الاكل صراحه يعني خلاص احنا الحاجات اللي بعرف اطبخها كلها طبختها يعني it's really boring يعني doing the same thing time and time again. So again being a bit creative يعني using a social media in a creative way, looking at other recipes يعني looking at other مثلا Indian food, Mexican food, trying different things at home, trying to بعدين it's takeouts are very expensive anyway يعني احنا we need to look after finances as well. So as parents well as adults there is a role and responsibility of modeling the behavior. Routine, making sure in the day is feel fun. يعني who wants to wake up كل يوم كل يوم I just want to do house chores, أكوي, أغسل, أعمل الأونلاين سكول حقتي, أشتغل بس في المطبخ. It is really boring. Doing fun things, doing fun activities, getting dressed. يعني أنا I find it really helpful when you wake up in the morning. Don't assume it's like زمان Saturday و Sunday أو الجمعة. أنا ممكن لحد آخر النهار لأنه بعد ذاك حقوم بعد ما أركلس كده بالبيجامة ولا كده ما خلاص أنا بكرة شغال. Tomorrow I'm not going to work. So every day is a day to get dressed, women to put their makeup, men to shave. يعني to do the practical daily steps, routines حقتنا. Exercise I cannot يعني emphasize how important it is. From a mental health point of view. Exercise بيطلع الendorphins بيخلي الزول يكون أساساً positive. وبيدي بوزيتيف فايب، بيصلح الانرجي حقت الزول، بيخلي الزول ذاته يحس بحيويته. يعني نحن في وقت يعني الخوف من المرض ومن المستشفى والرقاد الطويل، يعني it is يعني our responsibility to look after our health. يعني ما دام ربنا ادانا this health and we are in this good place, it is a responsibility to use it to the best way possible. يعني imagine الناس اللي بيكونوا في المستشفى they would love إنه يكونوا في البيت و having a nice time, having family around them, exercising, doing lots of things. So remembering the people we love who've suffered, who are in hospital, and trying to do something that we know that they would actually appreciate us doing. يعني it's small things that count. هي ما a full recipe of happiness, لكن that is the best way. Finding joy and pleasure in each other's company, having nice meaningful conversations, using a time at the time. يعني ما كنا نتخيل إنه يكون عندنا time مع أولادنا أو مع أزواجنا أو مع الفاميليز بالقدر ده. فlet's grow together فيه. البانديميك نحن الجنريشن حقنا، الجنريشن حق آبائنا ما حيقدروا حاجة اسمها زي بانديميك. ما في سكريبت، ما في prescription for how to manage this. We are learning as we go along, and sharing experiences. You do something fun, you find something that you found really joyous, helpful, sharing that with someone else. يعني using again social media in a positive way where we do positive things. بيعجبني الأطفال مثلا، حاسة هم من شدة ما خلاص يعني الحاجة الجميلة I noticed مثلا في my 13-year-old يتعلموا مثلا exercises, dances، حاجات زي كده من بعض بالسوشيال ميديا. So again, these type of things. في حاجة كان في واحد كان بيعمل برضو exercise online، الأطفال كلهم كانوا متابعين معه. It's very interesting in online schooling have kept the exercise PE as part of the curriculum. بيقولوا ما شغل لكم جرية في البيت. Again, as adults we need to do that as well. I hope that's helpful. يعني أنا حاولت أدخل كلام عربي
والله كويس، شكرا لك يا سارة. وسبحان الله أنت لما ذكرتي مسؤوليتنا تجاه روحنا ونحافظ عليها، ظهر في السكرين فجأة الناس بتحول طبعا السكرين ظهر شيخ بابكر اللي هو حيتكلم عن الموضوع ده هسه بعدي. في سؤالين معلش أنا عارف واحد منهم برضه أمانة حنسأله ليها. طبعا يا ما let me ask you in English لأنه most of those people are in English also. Many people, Dr. Sara, from the diaspora, the black and ethnic minority, this group which has been the focus, even in America, the same problem. They have been hardly hit, you remember, in New York. But in the UK, most of them really, they're living in small, backed flats. And I think this is something being raised even with the government, even with the isolation. Living in a house, you can isolate much easier, but living in a flat, and I know many, even Sudanese and others, it's really a nightmare. If someone needs to isolate, it's only 2-bedroom flat, maximum 3. So imagine, and there's no 2 toilets and so on, but not that. This will, I think those people will suffer more mentally than those in houses. Because in a house, you can have that mindful thinking, you can listen to a music in the other room. In flat, it's very difficult. And most people we know, they communicate us from black and ethnic minority, from African backgrounds, they really struggle. If there's any additional maybe advice to give to them, your advice was general, do these things and make sure. Exercise, for example, someone in a flat is very difficult compared to that. And the last question, so I wouldn't have to ask you again, you mentioned about the social media, and we will come to that one. And I don't want to put you on the spotlight, but many people see our social media, particularly the diaspora, the Sudanese in particular, there is very little happiness in our social media, very little to make you happy. Whatever groups, whatever your friends, either death, fighting, you know, all the political things going, we don't need to go into that one. But can you, as someone we really value, and that's why I always ensure we tell people this is somebody, specialist, consultant, experience. Can you send a message about the social media? Just advise people, like the religious people have done that. And we've been contacted from Sudan by a big American charity. They want to organize, they said they want Sheikh Babikr to deliver a message to even religious leader. Can you just send a message, even though us in the West, can we really more wisely use the social media in a way? It's not really so depressing. There's very little happiness. I have watched even social media Egyptian, Syrian, I have watched, even Tunisian I watch. There is lots of similarities. It's all about politics, fighting, accusing, not much of fun, really. What is your advice?
So I'll start with the last bit and go back to the first question afterwards. Again, it's very much about responsibility, isn't it? Mm-hmm. Incumbent upon us to put out positive messages. Incumbent upon us, people who are specialists or teachers, medics, social workers, to make sure that, again, the social media is populated with positive messages, with positive advice, with guidance. I'll give an example. I watched many of the events you hold, the medical aspect, the public health awareness ones on the vaccine before, on COVID-19, and these are watched by so many. I think it's difficult to say it's all negative. It's not all negative. There's a lot of positivity on social media. There's a lot of humor, sometimes a bit of gallows humor, a bit of morbid humor, but still a lot of that. People generally, when they are in difficult times, you find a lot of creativity comes across as well. Music, song, art, and just make sure that we're sharing these forms. Maybe our generation is not sharing it as much, but the younger generation are definitely doing that on Instagram, on Snapchats, on their blogging. There's a lot of sharing of achievements, of writing, of creativity. That is happening a lot. I've got sort of older children, so it's always helpful to see what's happening at their side. The religious sort of message can sometimes be also sort of, it's about sort of not separating the messages. So the religious message, the medical message, the mental health awareness message should all sort of be always mixed and sort of joined up together. It can't be one person saying something completely different. So again, a religious leader, say, for instance, asking people to make sure they're social distancing, they're wearing their face masks, they're observing all lockdowns effects, medical advice linking that, okay, that's the vaccine, the benefits of the vaccine, how you can do that, adding in some mindfulness techniques as well, how you look after your mental health. These are all part and parcel of the same message, but it's just important about how do we make them interesting enough? How do we make them widespread enough in social media? And again, social media is limited by those who can use it. Many people, our generation older, don't have access to social media at all. So how do we get those messages across? Is there a way of writing leaflets? Is there a way about sort of maybe telephone call type of messages? It's about thinking wider for the whole population and for the whole older, younger, and of course, adult age. I'll come to the first question about the BAME community. Nothing has exposed the discrepancy, basically, in health and in economy and all types of discrimination, if I can say, other than COVID. It really brought to the fore, to everyone's awareness, the difficulties with the BAME, Black and ethnic minority groups. It's not only the housing, it's even the all the determinants of health. Access to health, access to education, access to housing, to finances, opportunities. Interestingly enough, most of the workforce are Black and ethnic minorities. And this has been seen again with the number of deaths, with the number of fatalities we've seen with the Black and ethnic minority in the UK. Yet this does not translate really well in how again, this question I get asked all the time, but we thought he's a doctor. But again, it's not just being a doctor, it's our determinants of health gender as a Black and ethnic minority group, isn't it? It's about sort of, again, awareness of vulnerabilities. We have specific vulnerabilities in medical vulnerabilities as Black ethnic minorities that we have to be aware of. Issues, again, about the crowding, overcrowding in housing. Again, the social circumstances and economic circumstances. You hit the nail on the head when you said it's a one-bedroom flat. Where are they going to isolate? So again, it's a wake-up call for all of us, and it's very important as communities, as diaspora communities, that we take stock of this. Again, you look at all the Royal Colleges, or Royal College of Psychiatry, for instance. Now there are BAME representatives. You look at the government. There's a huge awareness about BAME issues and BAME activities. Again, the coincidence of Black Lives Matter at the same time. So again, a lot of awareness about the difficulties. And I think this is an opportune time for us to really shift things and change things into getting more advantages for people from Black and ethnic minorities. يعني أنا هتكلم شوية بالعربي، فبتكلم عن يعني نحن الدياسبرا، الناس بيقولوا عليهم شو بالعربي ethnic minorities، الناس المخويات.
او الاقليات اللي هنا،
او الاقليات. ايوه. فيعني اساسا احنا اساسا عندنا vulnerabilities لامراض معينه مثلا، يعني بتجينا اكثر يمكن من ناس ثانيين، لكن كمان الظروف حقت الناس اللي جات بها مثلا قاعده برا في الغربه في المهجر، يعني في من ناحيه اللجوء، من ناحيه مثلا العماله صعبه، السكن صعب، الحاله الاقتصاديه صعبه، الناس ساكنه مع بعض مدفوسه في حته ضيقه. فلما نقعد نقول لازم مثلا نعمل تباعد اجتماعي، يعني كلام خشم ساكت، لكن ما عنده طريقه انه ذاته يتعامل من ناحيه عمليه. فالحته بتاعت انه الجائحه دي عرت التفرقه زي ما بيقولوا بين اللي بيتعرضوا لها الناس الاقليات. ففي حته بتاعت انه في شغل المفروض حسه يتعامل بالحكومه، بالجمعيات الطوعيه، الجمعيات الخيريه، جمعيات حقت الاقليات نفسها، بانها ترفع من مستوى الاقليات ودائما توري الحاصل شنو. خاصه انه الاقليات هم اكثر ناس شغالين حزتهم في الحقل الصحي، يعني المتعرضين حس اكثر حاجه للجائحه، يعني الناس كلها طبعا متعرضه، لكن ده كمان لانه عندهم vulnerability اكثر، يعني ولما بتحصل لهم المرض بيحصل يعني بطريقه سيئه جدا، وحصل موت كثير جدا في الاقليات يعني بطريقه كانت ملحوظه جدا، لدرجه انه الببليك هيلث الطب العام في انجلترا يعني قاعد عمل بحث في القصه دي. فبنتكلم عن القصه بتاعت انه الناس مع التوعيه بيحصل ان شاء الله التغيير، فدي الحاجه الناس اللي بتعمل لها يعني. اتكلمنا شويه برضو عن السوشيال ميديا، انه ان احنا عارفين كلنا الحاجه اللي المفروض نعملها، لكن تتعمل كيف. نرسل يعني رسائل ايجابيه، حاجات مفيده، ما تكون كلها حاجات سلبيه وحاجات بتزيد القلق من بعض يعني. فانه الرساله الدينيه تكون يعني متناغمه مع الرساله الطبيه، مع الرساله النفسيه، الرساله الاجتماعيه، تكون في تناغم في المسجز. دي الحاجه اللي افتكر المهمه، انه الناس بعد تتعامل مع بعض وبطريقه انها تكون في تفاهم، بحيث انه الناس الائمه الشيوخ يكون في برضه اجتهاد بانه يكونوا يعني to be brought into نفس الفريم بتاع الثينكينج بتاع الناس الميديكس، الناس الصحه النفسيه. وافتكر المؤتمر حقك ده is a good example، دليل جميل انك جمعت حاجات مختلفه جدا مع بعض في فورم معين.
شكرا لك جزيلا يا ساره، دكتوره ساره بليل، استشاريه كبيره، ونحن فخورين بك جدا والله يا ساره. وبعدين just in English maybe in better or let's say in Arabic it doesn't matter. لما حتى why we have this session in both English and Arabic، لأنه when we contacted other we are involved in many communities, black and ethnic minority, Asian, Muslim. There's lots of even the good thing, the Labour Party. I'm not just preferring the Labour parties as others. They have their own something called Black Labour, which I'm very proud to be part of it. So they are also many people they recognize this issue about black and ethnic minority. But خلينا نمشي. شكرا لك يا دكتور، وخليك معنا في أسئلة كثيرة، لكن بس على الأقل انا كنت داير بس الجزء اللي انت عرضتيه ده مهم جدا، كنا عشان بعدين نقدر نواصل في الحياه الباقيه. Can you just give an advice to both? Most of the time the man is being accused of domestically abusing, so most of the time, although now in the recent studies they saying also there are women who are domestically violating men, but generally the statistic, I think you know it better than me, is men who are doing the opposite. Can you for now just give him advice again scientifically, sir, to keep things calm within the house, particularly now, even if you are almost about to divorce? I think it's better to stop it, keep it. How important scientifically this will affect you yourself, because this we're going to discuss now, it will destroy yourself. So please, and then we can go to the second session.
I would start first of all by agreeing with Amani, generally about the children aspect of things. Somehow Sudanese, we struggle to have peaceful divorces, if I may say. It's always acrimonious. It's always with a huge war and fight, and that doesn't make it helpful at all. So very important. The father will always be a father. The mother will always be a mother. They may not be together as a married couple, but they're always, the role as parent, that's always going to be there. And it's it is, as a parent, you are responsible for the welfare of your child. It's important about sort of being a role model. It's important about sort of, again, upholding the what parenthood is. The good things about your dad. You married the man at one time, so there were some good things, reminding him of that, reminding yourself of that as well. Yes, there may be differences, but it's important to be quite objective and think about the welfare of your son or daughter at that point of time. Because as an adult, you have already reached a decision, separated, divorced from the partner, be it a man, or the wife or the husband. But it's important to think about the welfare of your child and how important it is for a child to have a good sort of idea about who their dad is and who their mother is. So that's absolutely important. Regarding domestic violence, I think the first thing about domestic violence is talking about it. As a community, Sudanese community specifically, we tend to shy away from discussing domestic violence. And previously we used to say that doesn't happen in Sudanese communities. We know different, of course. It happens in all communities and all cultures. Again, COVID is difficult. People are stuck at home. They're in each other's face all the time. There's no me alone time. There's no respect of privacy, of differences. People are worried, naturally. It could be the husband's very worried about losing the job. They can't pay the rent. Like, emotions are pretty high. It's always important to remember that as you are suffering, your partner is also suffering. She's equally worried. It's the same worry. And it's the worst thing is we tend to, unfortunately, take people we have close to us for granted. And you'll find the domestic violence happens at home. It doesn't happen outside with friends. So again, it's important about thinking about, while yes, at home, your wife, you're really worried. If you are feeling very violent, you're feeling aggressive, you're feeling angry, go for a walk. Take yourself out of the home. Try and de-escalate the problem. Again, for the wife also, if you see the signs that things are escalating, pull back a bit. It's not your issue if he's the violent partner, but you need to look after yourself and protect your children as well. Reach out for help. I think that's the important thing. People fear, I'm talking about the UK specifically, people fear generally social services and children and family services. In the past, people worried about their children being taken away from them. But in recent years, social services have actually been very keen to work with communities and support communities, giving parenting classes, parenting skills, providing some support, giving some advice, giving even placements for children. To go out, have some time in a nursery setting, that sort of thing. So it's important to reach the resources around us. There are many resources. I'm aware of the community, Ajali Sudania, aware of quite a few resources because we've had this conversation in the past with them. But also looking at your local resources, local authority resources, and not to suffer in silence. You are responsible. Like you said, it happens to men, it happens to women, but the majority, of course, is the victim is the woman. As a wife and as a mother, you have a responsibility to your children. So it's not just yourself. It's not about, okay, and I'll tolerate this and it will be fine. You're actually responsible for the children, and showing your responsibility, you need to protect your children. So that is the bit where you need to actually talk to services, and sometimes introducing an outsider can be helpful. We did also talk in the past about having a community of seniors, Fijali Sudania, in the Sudanese community, to provide some support over the phone, or maybe before COVID, face-to-face. I don't know how far that developed, but that was something we discussed before. I don't know if people remember, there was an incident a few years back when, unfortunately, the man went to prison, the wife was in hospital, the children were looking for foster parents for the children, and it was a very difficult time for the Sudanese community in London. And at that time, we did talk about an initiative about, so there are many older senior people in the community, and about how, as a community, we support each other rather than everyone tries to distance themselves as soon as they know there's a problem family. We have to come together as a community. I hope that's helpful. Like it does require more time.
شكرا لك يا ساره، وتهيألي المسج واضحه انه يا جماعه الناس نكبه بيشد لحد ما كلنا والله كل المشكله دي يعني يسدس يعني قبل حسام ما خلى حاجه، وكل يوم بيجي زول ويجوا دكاتره كثيرين يا جماعه في البلاتفورم. بس هنا عندنا ما بالك في كل الدنيا في لايفات حايمه وفي سوشيال والغابات، والدكاتره دي يتكلموا ولا ما فيتروا يسدس يا جماعه. فخلونا نقلل منه لانه اوريدي احنا متوترين. انا زي ما وعدتكم اوريدي حنرجع الموضوع ده والله يا ساره. في حاجات كثيره كان في انيشيتيف زمان. انا اول ما جيت ايست لندن يونيفرسيتي كان بيقودها بروفيسور، ما انا كنت جيت ولقيتها قاعده was very successful to reduce the knife crime within the black. وسوني was well respected professor, Nigerian professor. He's our senior. He introduced to King Livingstone قال نجيب رو موديل يجي يتكلموا للناس. ومنهم كان ناس منه تريفا ماندونس وكده، يعني يجي ذول زي ساره دي تجي مش تدرسهم ولا تدكيذهم عن المنتال هيلث، لكن هي شيز رو موديل. وانا اي ثينك يو ار رو موديل وكلكم يعني هو زي السينيور قلت لي، لكن يكونوا مور اوف هم ناس مش اتشيفر انه بيكونوا بروفيسورات ولا كونسلتنت ولا لا، اي زول بس يكونوا رو موديل من حيث انهم they in their discipline they become they have work hard they manage to get because you are a senior consultant. انت كم سنه كونسلتنت يا ساره؟ ما اقدر اكبرك في العمر يعني.
ده ما هو حاسس عمرك كم؟
لا والله انا اقول لك
ده سؤال عمرك كم؟
لا والله، وانت كونسلتنج، لانه ليه؟ داير الناس لما يسمعوا، وانا بقول لهم دائما والله ما عشان بس بحاول يعني تبروموت الناس، انتوا تستاهلوا وده حقكم يعني، لكن بقول لهم يا جماعه لما تسمعوا يقول لك ده كونسلتنت وفي اليو كي اتس ا فيري سينيور جوب، يعني جات بخبره وبديسيبلين وبهارد ورك، وما بالك نجي الحته بتاعت البلاك نحن بنعاني منها في الاكاديميا وفي الهوسبيتال، يعني فور بلاك وومن، ده ستادي، ده ما كلامي انا، توب بروفيسورز عملوه، قالوا البلاك مين بيجوا الكاتيجوري الثانيه في الديسكريميشن، وبعدهم بيجي البلاك وومن، وبعد ذاك بيجي الديسيبل، يعني مثلا لو ديسيبل وومن وبلاك قال لك دي بتجي اكثر زول سيفير تتعرض، فلما تلقى بلاك وومن وكمان تجي تكبر سينيور كونسلتنت يو نيد تو فاكتور ذيس بلس بلس بلس، عشان كده احنا لما قلنا عملنا الارجيومنت انه ذوس diaspora they should be looked at very seriously by the government, the OECD's government, because they have worked hard to achieve. If you meet Professor Sori Nawangwa, he's very specific to me. He said to me, in order to become equal to another white academics, I mean, we talk about this publicly now. He said to me, you need to do double the work he does. This is a message from a senior black professor a long time ago, educating us. So I think I need people when they listen, ما يقول لك هاي سار عبد الجليل والأخصائية، لا. It's a huge, important advice. وبرضه other things. To get in the normal system to reach a consultant زي مثلا اماني، هسه اقول عندك طفلك عنده مشكله، عشان تصل للconsultant in the normal steps انت you may spend years to reach a consultant. ما دي you all you don't know, you know it. And I cannot go to Sara, I have to go to my GP يحولك للهوسبيتال ويجاب لك ريجسترار ولحد لما يجيبك consultant. That's the last point. فعشان كده I want people to make the best use of الطاقه والشيء اللي بيتبذل ده، وتسمع للناس seriously when they say this is what is it. Amani قالت لكم don't talk negative, please take her as a senior expert في الاريا, don't take it as a Sudanese or no culture وما culture. This is a medical from a top expert. Please, those who are listening in English or in Arabic, we really want people to listen to this from a top expert. They are top experts, so listen to it as an expert. Forget about the culture, or in the Sudanese we do this, or in the Jamaican or in the Nigerian. And by the way, lots of the problem we face in the Sudanese they face in other communities. I know that. I have seen many infighting and so on. يا سارة شكرا لك، ويا أماني شكرا لك.
بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد ميلاد، بلاد ميلاد.
ممتد لحد حدود